Do we love our NHS?
On the 75th birthday of our National Health Service, we went to Ealing Hospital, where activists, campaigners and those thankful for our healthcare system gathered to celebrate the wonderful work of healthcare professionals. We heard from lots of speakers, including doctors working inside the NHS.
Yeah, but it's not good enough that children coming into my clinic with mental health problems who are self-harming have to wait a year to see a mental health specialist.
And I've seen it, I've worked in hospitals and I work in general practice, and I have seen it sort of year on year, the conditions get worse and worse. And I have colleagues of mine that have worked a lot longer in the NHS, and they tell me that the conditions were much better and we were giving really good quality care. Now, we're not. It's the care that we're giving isn't good enough. The waiting times are not good enough. The delays in care are not good enough. And I don't want to work in a system where, I want to be able to give the best care to all my patients, and it doesn't feel like we're doing that right now.
We have to support the NHS workers who are going on strike, because they are striking to give better care to all of us, to all of our families.
The celebration took place the day after the publication of the NHS Long-Term Workforce Plan, a detailed government mission aiming to drastically improve the system for the benefit of both patients and staff. Health Secretary Steve Barclay described it as an unprecedented plan that will further boost the drive to cut waiting lists and ensure the service can continue caring for us for generations to come. Within this context, campaigners were keen to offer insight into what they thought the NHS really needs for its birthday this year.
We need a plan for how we train and retain staff in social care, and the next Labour government will deliver that.
What we also need to do is we need to get rid of the private sector from our NHS. It's a drain, it's a parasite. It needs to go. Every pound that you give to a private company to deliver a service is a pound away from the NHS, because you don't get the same value, because they're here to make profit for their shareholders no matter what.
The event, both celebration and protest, bore testimony to the fact that those who work in the NHS demand a strong say in shaping its future.
You can fight and you can win.